Breast and cervical cancers are two of the most common types of cancers that affect women. However, medical practitioners are convinced that early detection is most important in saving lives. Speaking on the topic, Closing the Care Gap, Dr. Frances McGill was one of 4 women to address the issue during GBN's Doctor on Call program.
The most common cancer across the world in women is breast cancer. And there are a lot of risk factors for breast cancer. Some are familial or genetic, so that you can't change that. Some of the risk factors that can be changed are obesity, because there's a lot of hormone called estrogen in the fat tissue. So if you decrease your body weight, you decrease the stimulation of the breast. We know from studies in the U.S. that taking hormonal medicines, and what a lot of people don't realize is a lot of the herbal products have hormone-type compounds in them. So after menopause, try not to do that unless it's really, really needed. Alcohol has been associated with breast cancer as well.
Dr. McGill delved into the issue of cancers affecting women, and her first advice is self-check and self-care.
You do breast self-exams. The important thing is to have your clothes off, of course. If you have a mirror, stand in front of a mirror, put the hands up over the head, put the hands on your waist and squeeze your waist, lean a little bit forward, and you're looking for any changes in the breast. You're looking for any dimpling. You're looking for any skin changes. You're looking for the skin pulled in. You're looking like the skin to look like the peel of an orange or an ugly fruit. And then you take your fingers of whatever is the hand you use most, the dominant hand. You put your hand up over your head, and you gently but firmly press the breast against the chest wall, feeling all the way around and feeling if you feel any lumps or anything that's changed. Now, right before we get periods, oftentimes the breast gets a little bit more dense and more full because the hormones are very high before the period. And then after the menstrual period, the hormones drop. So the best time to check the breast, if you still get periods, is after the period. And if you don't get periods, then pick the same day every month. You do it tonight because you learn to do it the same time, the same day as your birthday, the same day as your favorite number. And then you continue to go around, and if you have large breasts, you need to press deeper. And I always suggest you check the breast that doesn't feel like it has anything first so that you can compare. And then recheck it again in a couple of days, make sure that it's nothing, that there's no hormonal changes. And if something is persistently there over a few days, a week, or a couple of weeks, then certainly see your doctor.
This advice may not be pleasant for some, but it can make a difference in someone's life.
The main factor is associated with sexual activity. And the main cause of cervix cancer that we know for sure now for the last probably 30 years is it's caused by a virus, which is a silent virus. It's not a COVID virus. It's not a flu. It's not a sore throat. But it goes between sexual partners. And the man usually does not have any problems on the penis. Sometimes he might have a little bit of warts. And we are not good at testing the men. But the woman then gets this silent infection caused by the HPV virus that can be picked up years before it becomes a cervix cancer, 3 to 10, up to 20 years before a cervix cancer, by very easily doing a pap smear.
For GBN Health, Janelle McDonald.